I'm Alexa.
And I'm Kylie, and this is our foot evaluation video.
For the sake of the video and time, we will not be doing a bilateral exam.
Before we start the exam, we would ask the patient, what happened? Did you hear any noises?
What type of surface were you on? Any medical problems? And any deformities?
Some deformities are pes cavus, which is a high arch of the foot, and claw toes, which is hyperextension of the MTP joint and flexion of the DIP joint.
Morgan's toe is when the first big toe is shorter than the second toe, and hallux valgus is when the first toe overlaps the second. Do I have permission to touch you throughout this whole evaluation?
Yes. Do I have permission to touch you throughout this whole evaluation?
Yes.
Okay.
This is the medial malleolus. Right here is the navicular. Right here is the first cuneiform. Right here is the third cuneiform.
I'm finding the talus by inverting and everting the foot. I'm now palpating the first metatarsal, the second metatarsal, third metatarsal, fourth metatarsal, and fifth metatarsal. I'm now palpating the DIP joint of the second through fifth phalange.
This is an example of percussion of the first metatarsal. The next fracture test is tapping each toe at the distal end.
Oh, now I'm using the tuning fork to test for fractures.
I'm not like looking for a live.
Oops. I will now be testing range of motion of the big toe, and we'll be testing flexion. I'm lining up the axis at the MTP joint and keeping the stable leather arm here. And her starting point is roughly 175. Now, Alexa, can you please bend your big toe down towards the floor, please? Okay. Now we're sitting at about 149. So, wait, you can pause. So that was active. Okay, so I just tested active, and now I'm just gonna push it down as far as I can go to test the passive. And it is, I would say, about 132.
I will now be measuring the lateral toe flexion. I'm gonna line the axis up with the first MTP joint and hold the stable arm here. And Kylie, can you push your first toe back? Her starting range is 144. And can you curl your toes toward the floor? 172, and passively is 182. I will now be measuring heel inversion. I line the goniometer up with the heel and Achilles tendon. So Kylie starts at about 178. And Kylie, can you invert your foot? She goes to 142, and then passively 137. The spring ligament is between the navicular and the subsentaculum tali. The tarsal ligaments are between each of the tarsal bones. If I were to test the ligament between the first cuneiform and the second cuneiform, I would find each of those bones and do a shearing motion.
The metatarsal ligaments attach the metatarsal bones, so I'm just gonna find it.
And that's the last.
And perform a shearing motion. Okay, I will now be palpating the Achilles tendon. It is activated by plantar flexion, so you can plantar flex your foot. And the insertion is at the calcaneus, and it connects to the gastrocnemius muscle and soleus muscles. I will now be palpating the extensor hallucis longus. The action is extension of the first MTP and IP joints and assists in ankle dorsiflexion. The origin is the middle 2/3 of the anterior surface of the fibula. The insertion is base of the distal phalanx of the first toe. The nerve is the deep perineal in roots L4, L5, S1. Can you dorsiflex? Thank you. Let me just cross over.
The extensor digitorum brevis muscle originates at the distal portion of the superior and lateral portion of the calcaneus. It innervates on the dorsal surface of the first phalanx base, proximal phalanges of 2 through 4, distal phalanges via extensor digitorum longus. The action is that it extends 1 through 4 MTP joints and assists in 2 through 4 PIP and DIP extension, and is innervated by the deep perineal nerve. Can you extend your toes? The flexor hallucis longus tendon originates on the posterior distal 2/3 of the fibula and innervates down on the plantar surface of the proximal phalanx of the first toe. The action is flexion of the first IP joint. It assists in flexion of the first MTP joint and foot supination and ankle plantar flexion, and is innervated by the tibial nerve. Can you tilt your foot inward and curl your big toe? Can you turn your foot inwards and curl your big toe?
I will now be palpating the flexor digitorum brevis. The origin is the medial process calcaneal tuberosity in the plantar aponeurosis. The insertion is on the plantar side of the middle phalanges of the lateral 4 toes. The action is flexing the lateral 4 toes at the proximal interphalangeal joint, and the innervation is the medial plantar nerve from the tibial nerve S2 and S3. I will now be palpating the flexor digitorum brevis. I'm going to hold your one toe back, but can you flex the other 4? Bring them towards you. Thank you. And I'll start with the 5th. The 4th. And the 3rd. And the 2nd.